Good morning, everyone. I am Rosemary Newman, and I'm a social service specialist with Afterwards. And today we welcome you to Medicare 101, the choice you need to make. Today's presenter, Susan Grossinger, has over 30 years of experience working with older adults. 22 of those years have been and still is as an employee of Advocate Good Shepherd Hospital as a hospital senior service coordinator. And for over 18 of those years, Susan has served as the Medicare Senior Health Insurance Program counselor. Susan's career has allowed her to assist seniors through case management, community relations, and programming, and by providing service information to help seniors and those who advocate for them to navigate the challenges in understanding Medicare policies. She even became a master trainer and developed a Matter of Balance fall prevention program to enhance senior health and safety, while still finding time to volunteer on the board of directors of several organizations. She's a very busy woman and very dedicated to seniors living their lives to the fullest. So it is my pleasure today to introduce to some and present to others our presenter, Susan Grossinger.
Thank you. Hi, guys.
Hello.
Okay, I'm gonna just tell you off the bat, I'm gonna try to stand. I had a knee replacement 6 weeks ago. And even though I'm a master trainer in fall prevention, my dog pulled me down my stairs. So it can happen to the best of us. Fractured my knee, tore ligaments, and just 6 weeks ago, then had to have my knee replaced. So I will try to stand, but after a while, my knee may start arguing with me. So I'll do the best I can. Is anybody here close to 65 or turning 65 or transitioning to Medicare? Okay, so this is normally an hour and 15-minute program. So I'm going to have to kind of pick and choose what is important. So there are a couple things that I really want when you leave here to understand. And that is Medicare used to be very easy. You got Medicare, maybe you got a supplement. That was it. There was no drug coverage, just had medical insurance, primary Medicare, secondary supplement, boom. In 2005, they implemented the prescription drug program and another way to get your Medicare benefits. So now it is more complicated and people are like, what? And they're getting contacted by all these insurance companies, and the insurance companies are talking about all different types of benefit or plans. And people may not make the best choices. My goal here is I want people to understand the choices they have to make so that they can maybe work with a SHIP counselor, which is what I am, or someone else to help them choose how do they want to get their Medicare. Okay, let's see here. There we go. So this is me. I am a certified Medicare counselor through the Illinois Senior Health Insurance Program. So in 2005, right before the prescription drug program and Medicare Advantage program were implemented, I got trained by the state of Illinois. I've been working with seniors in Medicare for 30 years, but it wasn't very complicated back then. So now it is more complicated. And when it came about, I decided I better make sure that I understand all the policies, legislation, all the things about Medicare. People can make mistakes and may, need help picking what they want to get. So SHIP's mission is to empower, educate, assist Medicare eligible individuals, their families, caregivers through outreach like I'm doing now, counseling, training to help you make informed health insurance decisions so that you can optimize your health care and your benefits. All right, that's important. Unfortunately, you need to know what you have. I can't tell you the number of people when they come in to see me and I'm helping them transition to Medicare, I'll say to them, you're on an employer plan. What's your maximum out of pocket? How are you covered? I don't know. Well, when we're working in young, we're hopefully not using it. So if you don't use it, you don't know what you have. Okay, I had my knee replaced 6 weeks ago. I know what my insurance covers. I see the bills, I see the explanation of benefits. But a lot of people don't. And then you get to Medicare and you have to understand what your insurance is. It's unfortunately your responsibility. There we go. So we are here to help. SHIP counselors, that's what we do. We help people understand their choices. How does Medicare work? What is Medicare prescription drug coverage? What is a Medicare Advantage plan? What's the difference between original Medicare and a Medicare Advantage plan? We are here to help with that. We can help people enroll in the prescription drug program or a Medicare Advantage plan. Medicare supplements, we'll talk about briefly. They are not part of Medicare, but they're there to help people who are on original Medicare as a secondary insurance. Okay, so we're here to help. We do have a helpline through Advocate and also an email. If people have questions, they want to, we have people at most of our Advocate sites. I'm at Advocate Good Shepherd Hospital. My coworker Sheila is here with me. She is also a SHIP counselor. So we're there together to help people. There are many people transitioning to Medicare. So we are busy. And then we'll talk about enrollment periods. There's an annual enrollment period that people can make changes and choose different plans. So that's like our tax season. We're like tax consultants with that because we're so busy. Today, we're going to talk about what is Medicare. There are 4 parts to Medicare. Some of the cost. What is a Medicare supplement? Again, it's not part of Medicare. Another word they use is a Medigap plan. Medicare Part D, that's the prescription drug program. Medicare Part C, Medicare Advantage. Then we'll kind of do a comparison real quick. I'm gonna briefly go through enrollment periods. That is where people sometimes make mistakes. And the reason that happens is when Medicare was created, right? The retirement age was 65, you got Medicare at 65. And at the time they said, sure, here's free healthcare. You probably only live to your 70. No problem. That was in 1965. Well, my aunt just died. She was 99. So, but people are working beyond that Medicare eligibility age. And so it's important to understand what you need to do if you're going to continue working and stay on an employer group health plan. And your Social Security, that's different. I was born in 1959. My full retirement age is 66 and 10 months. Anybody born 1960 and later, it's 67. So a lot of those things have changed and make retirement and all that more complicated to know what you have to do. Welcome to Medicare. Woo-hoo. Okay, but there's the maze. And as a SHIP counselor, that's what we try to help people get through. So Medicare is your federal government program that offers your health insurance. Okay, it's for those people 65 and older. If you're under 65, you've been deemed disabled by the Social Security Administration. After 24 months, you are automatically enrolled in Medicare. If you are diagnosed with end-stage renal disease or ALS, which is terribly unfortunate, you automatically qualify for Medicare. You have to be a U.S. citizen or a permanent legal resident that's lived in the U.S. for a minimum of 5 years in a row. Medicare is managed by the Centers for Medicaid and Medicare Services, which is called CMS. So just a note, your work history or your spouse's affects Medicare premiums, your Medicare Part A, whether you have a premium or not, it does not affect eligibility. So even if you didn't work or pay into the system, you still could sign up, but you could have a $450 Part A premium. If you work 10 years or 40 quarter hours and put into the Social Security and Medicare system, Part A can be free. So it's not whether you're eligible, it's whether you would get a Medicare Part A free premium or higher. If you're a spouse, you have a divorced spouse, and you maybe aren't eligible for free Part A, you can actually apply for Medicare benefits on the work record of that divorced spouse, but you have to be married for at least 10 years. So what's your path? When I work with someone, huge, I need to know, where are you going? Where are you on this journey? Are you retiring at 65? So you do need to go to Medicare because maybe your employer group health plan is ending. Do you plan on working past 65? Maybe you don't need parts of Medicare, so that can be delayed as long as you're working and on an employer group health plan. Or are you covered under someone else's plan when you're turning 65? So again, they're working, you are covered under their employer group health plan. So maybe you don't need Part B, but maybe you might want to get Part A. It depends on who the employer you work for and how many employees there are. There we go. That. So there's 4 parts to Medicare, okay? Part A and B. Part A is hospital insurance. That means you're an inpatient in the hospital or a skilled nursing facility. The nursing part of home health care, that is Part A. The hospice care, which is the nursing part of healthcare, is Part A. It's the skilled part when you're getting services. Part B, medical, everything else, physicians, emergency room, ambulance, day surgery, tests, colonoscopy, anything that's not an inpatient stay in a hospital or skilled nursing facility. Some parts of home health care and some parts of hospice is Part A, Part B. Those 2 things together are provided by the federal government. That is your Medicare, A and B together, okay? Part D and Part C are offered by private insurance companies that are contracted with Medicare to provide that benefit. So Part D is the Medicare prescription drug program that was created, it was implemented in October 15th of 2005. Benefits started January 1st of 2006. So before then, nobody had drug coverage. My mother passed away in 2002. She was a diabetic and had cardiac disease. She spent $800 a month on drugs because Medicare had no drug coverage. Now there is, but it's provided to people through private insurance plans, through a standalone prescription drug plan, or you can get it through what's called Part C or a Medicare Advantage plan. The Medicare Advantage plan is a contracted insurance plan. It bundles your A, hospital insurance, your B, your medical, and your drug coverage in all one insurance plan. Okay, so we'll talk about there's 2 different ways you can get your Medicare. There's the original way, which I'll show you, and then there's the other, which they call Part C, which is a Medicare Advantage, either HMO or PPO, where it bundles the Medicare benefits into one insurance plan. This is what's so confusing, because if you're turning 65, I'm starting to get stuff. You are getting bombarded by insurance companies that are selling just Part D. They're selling supplements or a Medigap plan, or they're selling Medicare Advantage. Good. And that's the problem. People are like, what is all this stuff? I have people walk in and they go, can you tell me what this is? I go, well, throw it all out first and then we'll talk. Okay. So those are insurance companies that are trying to sell the supplements and the Part D and the Part C because they're contracted with Medicare to do that, to provide that benefit. Okay. This is a great chart. And if you remember anything, because we only have 45 minutes together, I want you to remember this. This distinguishes the difference in your choices when you are going to go to Medicare. And again, what's your path? Are you going to retire at 65, or you're on a marketplace plan, which is, the healthcare.gov. You got to go to Medicare as you turn 65. So if you are turning 65 or you're retiring, you've been on a group health plan you're 67 and it's time for you to retire. You've got to decide, how do you want to get your Medicare benefits? How do you want to get the A and B, your medical, your hospital insurance, and your drug coverage? There's two different forms that you can get it. Okay, let's see if my little, oh, it works. I'm so happy. Okay, so this side, this is the original way that people get Medicare. I will tell you, when Medicare Advantage and drug coverage first started, only about 9%, 9 to 19% got it this Medicare Advantage way. It is now 50-50. Okay. We're baby boomers. We've been on managed care or, HMOs and PPOs our whole working life. So this is not so foreign to us, going to an insurance plan for our Medicare. Other people, and we'll talk about quickly what the difference is, want to do it the original way. So the original way is, I applied for Medicare, let's say me, I'm the person. I applied for Medicare A and B, okay? I'm retiring or whatever, it's time for me to go to Medicare. You have to sign up through the Social Security website. Social Security is the window to Medicare. So I applied for Medicare A and B. I've decided I want to get my Medicare benefits this way. Okay, so I've got my A and B. Well, Medicare A and B doesn't cover everything 100%. So I may be on a fixed income, and I've decided I don't want to take any risks. I'm risk averse. I want to know what my bills are up front. So I've got A and B. I'm going to get a Medigap plan, and that Medigap plan is going to pick up most or almost all of my bills after Medicare pays. So I've decided I'm going to pay for Medicare B and a supplement, so I don't have medical bills. So I'm paying in advance, so I'm not paying later, but I'm paying for what if, right? That's what insurance kind of is. I've decided I want to take the risk out. I'd rather do it and be secure through the Medigap plan. All right, we'll talk about the differences and why people do one way or the other. And then I got to get a separate prescription drug plan. Okay, so basically I'm going to have 3 cards: Medicare A and B, my Medicare card, that's my primary insurance. I show that to all my providers. Then my Medigap or supplement is my secondary. And that's what I show to my medical providers: my Medicare card, my supplemental card. And then when I go to the pharmacy, I show my Part D card. So I have a premium for B. My A is free because I worked a long time. Okay, I worked more than 10 years. So my A is free. I've got a premium for B. I've got a premium for my Medigap plan because I'm paying for that. So I don't have to pay for things later. Well, but what if I'm healthy for 10 years? I'm paying for that supplement for what if, kind of like homeowners. How many decades do we pay for homeowners and never file a claim? This is health insurance. It's the same concept. I've decided I'm risk averse. I don't want to take any risks. I want to pay for that. And then I have a separate Medicare Part D plan for the pharmacy for my drugs. Okay, as a SHIP counselor, I can help people, and I help people enroll in A and B. I say I don't know where to start. I've gone through applications. I do it with them on through their My Social Security account. I cannot enroll people in Medigap. Those are private insurance plans, but I can show quotes as a SHIP counselor. The state of Illinois gives me the ability to see quotes, and then they can shop themselves, or we have lists of independent brokers on our website. There are tons that can shop and write the policy for the supplement. They can actually, because it's a private insurance plan. The Part D, I can enroll people in because it's a Medicare benefit. You go on the Medicare website. I've been doing it since it started. I help interpret based on their drugs, okay, and the pharmacy they want to go to. There's 24 Medicare Part D plans in the state of Illinois. There used to be 60. So finally, the state of Illinois said to the insurance companies, hey guys, there's no difference between number 2 and 3 plan. You know, either make a difference or get rid of that 3rd plan. So it's much better than when we first started. We were at 61 and 57 and 47. Now we're down to 24. Woo-hoo. Okay. It is not as complicated for me to help someone pick a plan. It's based on your drugs that you take and the pharmacy you want to go to. That's it. Where are you going to save? Where are you going to spend the cheapest, the least amount of money? So this is the traditional way. Okay. Medicare, supplement, Part D standalone plan. The other way to get your Medicare benefits. So is to get a Medicare Advantage plan. This is Part C. It basically provides you with your hospital, your medical, and if you want your drug coverage in all one insurance plan, an HMO or a PPO. That is your Medicare insurance. Your Medicare card, you only use when you're switching plans, your number. That when you have this way, Medicare's paying your bills. When you go to a Medicare Advantage plan, Medicare is in the background. They are paying that insurance company to insure you. 62% of these Medicare HMOs and PPOs don't have a premium. In whose world does health insurance not have a premium? You still have to have B and pay that premium, the A and B. But if there's no premium, somebody's paying somebody something. That's people go, well, why do I have to have A and B? I've got this HMO or PPO. Because you're not paying for the premium Medicare. Medicare pays that insurance company a monthly stipend for every Medicare beneficiary they insure. So this is an HMO, it is a PPO, it is a Medicare product. Okay, so you have to have A and B, you have to pay your Part B premium, but again, you can get a Medicare Advantage plan with no premium. And it's structured differently than original Medicare. So with original Medicare, Medicare A and B pays your bill, then you get a Medigap plan to pick up the out-of-pocket or most of it, and then a separate drug plan. With this, it's structured just kind of how an HMO or PPO is. You're going to have co-pays and co-insurance from all of your services. So you're paying very little in advance, just your Part B premium, but you pay as you go, okay, as you render healthcare. So if you don't render healthcare, you don't pay, right? Okay. The drug coverage can be, and about 90% of the Medicare Advantage plans have the drug coverage in it. If you don't get drug coverage when you're eligible, you'll get a penalty later. Okay, if you're not on an employer group health plan. So if you understand anything, because you're going to get bombarded about all these different products. Again, you're going to get stuff for Medicare Advantage, for Medigap or supplement, and for Part D. Because those 3 things are provided to you by insurance companies. All right. So to me, when I work with someone, I say to them, how and where do you want to spend your healthcare dollars? Okay. Do you want to spend in advance so you're not paying later? But you're paying for what if, right? Or would you rather pay less in advance if they don't have a premium, 62% don't, and you're only paying your Part B premium, that comes out of your Social Security, or if you're not getting Social Security yet, Medicare will send you an invoice. But you don't pay in advance or very little, and then you pay as you render healthcare. Co-pays and co-insurance based on the service you get. Now, can I ask where some of the counties that you may live in? Like I live in McHenry County. There's 52 Medicare Advantage plans. Anybody live in Cook or Kane? There's 59 Medicare Advantage plans. Okay. I think Cook and Kane have the highest number. I don't know about DuPage. Lake County has 43. Woo-hoo! Somebody thinks choice is good. I don't know. But as a ship counselor, What I help people do is whittle down. I help them filter those plans, if that's what you're interested in. Because they are HMOs and PPOs, so there's networks. You have to think about what your doctors will accept, what your hospital will accept. You have to think about maximum out of pockets. Do people know if they're working, what their maximum out of pocket is? Mine's 6,000 with my husband's employer. Not the deductible, but your maximum out of pocket. Many of the Medicare Advantage plans don't have a deductible, which is nice. But there's maximum out of pocket. So if you're on a fixed income and on Medicare, I say to people, if you had a bad year, what could you put out in co-insurance and co-pays to meet that? And you may. And what I mean by a bad year, I'm talking cancer. I'm talking chemo treatments. I know someone who had non-Hodgkin's lymphoma. They had an employer plan, a PPO. It had a $5,000 maximum out of pocket. They were in treatment every 3 weeks. They met it in 2.5 months. So you have to, don't cut your nose off to spite your face. Yes, this is cheaper in advance, but you will pay as you go. And you may never meet that maximum out of pocket. I've seen, and I had an 86-year-old lady that loved the Medicare Advantage. The only thing she had done, like me, was her knee replaced, and she did not have that much out of pocket. Okay, I'll tell you, I probably $2,800 I've put out, and I'm not done with physical therapy. Okay, between the hospital, the doctor, and my physical therapy. So you have to think about those things. So that's why I say to people, where do you want to spend your money and how? That's what this is kind of all about. Some people say, I just want to give people my Medicare card and my Medigap or supplemental card, and not have to worry about anything. Well, that's good, but these go up as you age. By the time you're 90, right now you're paying about $400 a month. If you're 65, it might only be $120. But they go up as you age. The Medicare Advantage plans do not. But the Part D plans and the Medicare Advantage plans, they are with insurance companies that are contracted with Medicare. They sign new contracts every September. So that's why we have this annual open enrollment period, right? Between October 15th and December 7th, if you're already on Medicare, people are coming in, they want, because those companies sign new contracts for 2024. And so people want to know, what does my plan look like? The drug coverage. If they're on a Medicare Advantage plan, are their doctors still in network? What is the drug coverage like? What is the coverage? What's the maximum out of pocket? So you need to review every year, because you may not change and think everything's okay, but the company and that plan can change. I've had people that did not look at their Part D plan, and one woman was a volunteer at the hospital. I said, why didn't you ever come see me so I can check your drug coverage? She had signed up for a Part D plan with the same company she got her supplement from, which is not the right thing to do. And so she came in, and thank God she did, because she was on Advair, which is an inhaler, and it's about $600 retail. Right. Okay. And it was taken off the formulary of her Part D plan. And if she had not come in and seen me, she would have walked into her pharmacy in January, and they would have said, this is not covered. Well, what's $600 times 12? I think I saved her $5,000. So it's really important, especially if you're taking medications, to check your Medicare Part D plan every year, or to make sure under your Medicare Advantage plan that your doctors are still in network, that your drugs are covered, that everything looks good from year to year. Some people don't like that. I think it's great, because you're in control. If something doesn't go right, if you don't like that company, if you don't like the coverage, you are in control of that. And yeah, it is cold in here. And between October 15th and December 7th for January 1st, You can say, I'm out of this plan, I'm in this plan. And then if you don't like it during the year and they're driving you nuts, the customer service or whatever, you can switch again. And some people don't like switching. It's a good thing. Because that's the only way to keep these insurance companies playing nicely in the sandbox. Because if they don't do things right, and companies have been sanctioned where they could not enroll people for a year and a half. That is millions of dollars that they are losing by not being able to enroll people. So Medicare does, for the Part D and the Medicare Advantage plan, they do surveys. You'll see that there's star ratings, and you want to pay attention to that. If somebody has less than 3 stars, you don't want to go with that company, no matter how good the benefits look. Okay. So again, we don't have a lot of time, but if you remember anything, these are the choices that you have when you go to Medicare. Not if you're on an employee group health plan. If you work for an employer and it has more than 20 employees, you can stay on that employer group health plan and you will not get penalized when you do want to go to Medicare. So a lot of people just, if you're not on an HSA, which is a health savings account, and then you're usually on a high deductible plan. But a lot of people just get Part A if they're still working and work for a larger employer. If you have less than 20 employees, Medicare needs to be primary, and you'll have to get A and B. That's just kind of the rules. So I'm on original Medicare Part A. I'm using my Medicare card at my medical providers. The hospital stay, if I stay in the hospital as an inpatient, I'll have a $1,600 deductible, whether I stay as an inpatient for 1 day or 15 days. It's that. There is something with Part A services called a benefit period. So say I'm in the hospital for 7 days. I go to a skilled nursing facility upon discharge for 7 days. I've used 7 of my 150 hospital days and 7 of 100 skilled nursing days. But then I go home, I'm out of the hospital or a skilled nursing facility for more than 60 days. Guess what? I'm in a new benefit period. I'm back to day 1 for my Medicare hospital days and back to day 1 for my skilled nursing days. The disadvantage is if you go back in the hospital after 60 days, you have that new $1,600 deductible. Skilled nursing for the first 20 days, Medicare A pays 100%. After that, it's $200 a day between 21 and 100. After that, if you haven't gotten back into a new benefit period, if you have to stay in a nursing facility, you have to pay. It's kind of considered full fee for long-term care. Home health, 0. And then there's 20% co-insurance for durable medical equipment. So I'm going with the original Medicare. That's what I'm talking about here. So that's my Part A. My Part B this year, if you $164.90 for Part B premium, it is higher for higher income people. So if you're an individual and you earned less than 97,000, or your adjusted gross income is less than 97,000, you pay $164.90. If you're a couple, a joint return, it's $194,000 or less. Social Security will tell you what your Part B premium is. There is a yearly deductible of this year of $226. It actually went down from $233 last year. And then Medicare Part B pays 80%. So after that $226, say I go to the emergency room and I have some tests. Well, Medicare Part B pays for the emergency room. I have to meet that $226 deductible. And then after that, Medicare B pays 80%. I'm left with a 20% co-insurance. If you have Part B, you must get Part B if you've decided to transition to Medicare. To purchase a Medigap policy, you have to have A and B to get a Medicare Advantage plan. If you have less than 20 employees for your employer and you're turning 65, but you want to continue working, they may require, most do for a small company. I even have had small employers tell their employees, It's time to go and get off of our insurance, because the older we get, the more we skew their premiums and what they pay for their employees. So employer coverage usually requires it if there's less than 20 employees to have A and B. So if you have coverage through active employment, there's no penalty for Part B or D within 8 months of losing creditable health coverage, or when employment ends, whichever comes first. If you do not have coverage from active employment and you don't get Part B, you may have a higher premium because you're going to get a penalty, and then you may not be able to sign up for Part B till later, and then you may have to pay out of pocket for a while. Oh, there he is. Hi. This is what I talked about if you have a higher income for Part B. It's called IRMA. I was giving a presentation. There was a hurricane at the time called IRMA. I felt terrible. But this is IRMA, income related Medicare adjustment amount. And it's based on your adjusted gross income for 2 years from 2 years ago. So if you're, like I said, if you're single and you have adjusted gross income of less than 97,000, it's that 164, or a joint return of 194, it's that 164.90. But as your income goes up, so does that Part B premium. Medicare will let you know. The big issue here is if somebody is retiring, say somebody retired in February of this year. Well, and then Social Security goes, oh, well, your income, your couple was between 194 and 246. You're going to pay 230. But you're saying to Social Security, wait a minute here, I'm retiring. I'm not going to have the same adjusted gross income I had in 2021 this year. You can appeal it. Okay, so I always tell people, don't panic. You can appeal this. And this is the form. It's called a Medicare Income Related Monthly Adjustment Amount Life-Changing Event Form, an SSA 44. And work stoppage or work reduction is on there. And what you're basically saying is, hey, 2023, this is what I think our adjusted gross income will be. And compared to what you got, the information you got from the IRS, they're connected to the IRS, okay? And you submit this form with proof of retirement, a letter of separation, and then it usually takes about 45 days. And they'll, even if you're really high, like I have a friend, he's really high up there. I said, you've got to appeal because 2021 was really high for him, even retired. They sold some income related property. So it may not bring you to the lowest point, but it may knock you down a couple categories. So be aware that you can appeal this if you get that letter from Social Security that says you have the IRMA. So Medicare supplements or Medigap plans, they're extra insurance sold by private insurance companies. Some of the junk you get in the mail. If your doctor accepts original Medicare, they'll accept that supplement from any company. It doesn't matter. There are not networks with original Medicare. The doctor accepts or hospital accepts Medicare, they're going to accept your Medigap plan. The best time to enroll is you have a 6-month guaranteed issue period from the time your Part B starts. People who make a mistake and get A and B, even though they're on an employer group health plan, for one thing, you're paying for nothing because B pays 80%. Well, if your employer insurance pays 80%, B's not going to pay anything. So you're paying a Part B premium for nothing. The other thing is, if you go beyond 6 months from when your B starts, you've knocked yourself out of a guaranteed issue period. And that when you do go to retire or your spouse retires, I've had people, the spouse didn't get B, but the wife did. I didn't understand that. So she had been on B for 4 years. Besides throwing money out the window, she didn't have a guaranteed issue period to get a supplement. So she did have to go through underwriting. She was healthy, luckily, and she passed. So the first 6 months from when your B starts, they cannot ask any, I hope you don't mind that I have to sit just for a second. They cannot ask any medical questions, okay? They have to, it's guaranteed issue. You want a supplement from this company? Fine, here you go. You have that 6 month period from when your Part B starts. After that, the supplemental companies can medically underwrite. So if you want to change after that, or for some reason you didn't get a supplement during that 6-month period, or you were on Medicare Advantage for 5 years and you want to go back to original Medicare and get a supplement, you're going to have to go through underwriting. We are lucky in the state of Illinois, we're one of only 6 states in the country that requires one company be guaranteed issue, and that's Blue Cross Blue Shield. So they will give someone a little bit cheaper premium if they go through the underwriting. If they don't go through the underwriting, it might be a few dollars higher. So I've had people in the hospital on Medicare Advantage from another state. We're moving back here, couldn't get chemo. They were on an HMO, couldn't get their chemo once leaving the inpatient care. So luckily it was close to the first of the month. I used a move special enrollment period. We got them back into original Medicare because he was on an HMO. Once they left the hospital, there was no coverage. It was a California HMO, Medicare Advantage. So we got him into a supplement because I was able to enroll him in a Blue Cross Blue Shield supplement. No medical questions asked, active non-Hodgkin's lymphoma diagnosis at that moment. So you have to kind of think about, that's the other thing people always say to me. Well, I hear you can't go back and forth. Well, yes, you can. Okay. Let's go back to this for just a second. So if you're here and you want to go here, these do not ask medical questions. You can do it any open enrollment period. Easy peasy. Okay. But later, say you're on a Medicare Advantage plan, you have 12 months. If you go to Medicare Advantage, either for the first time when you're 65, or you were on a supplement, you dropped a supplement to go to Medicare Advantage. For the first time, you have a 12-month trial period that anytime during that 12 months, you can go back to original Medicare and get the supplement, no medical questions asked. Once you're beyond that 12 months from Medicare Advantage initial first enrollment, then if you want to go back to traditional Medicare and get a supplement, you will be subject to medical underwriting unless you go to Blue Cross. Okay, medical underwriting, it sounds scary, but you have to have some big ticket issues. Okay, Parkinson's, congestive heart failure, COPD. They don't like atrial fibrillation. They may accept you, but they'll charge you a higher premium. So there are, it's big stuff. Cancer within 2 years, surgeries, being bedridden, ALS, those big illnesses, they will deny. But if you just are on a cholesterol or a high blood pressure medication, you'll be fine. You'll be able to switch. So that's the issue here is it's easier to go from original to Medicare Advantage. There can be some issues and it's with the Medigap or something, switching back. Okay. All right, let's go back. Sorry about that. Just wanted to. Oh gosh, I went the wrong way. Okay. Okay, so the supplements, they're the same. If you get a plan G, it's a plan G is a plan G is a plan G. No matter what company you go to, the benefit is the same. You can purchase or change a Medigap policy throughout the year. However, you may not have that guaranteed issue. So that open enrollment, which is October 15th to December 7th, is really only for Part D or Medicare Advantage, the Medicare products. Supplements are not part of that. You can change your supplement anytime during the year. The supplements, Medigap plans, are not part of Medicare. They are standardized, but they're not part of Medicare. So these are the supplements, okay? There used to be 10. Congress got rid of the C and the F. Those are the only two plans that picked up the Part B deductible. Why did they do that? Well, they didn't ask me, but they decided that if seniors had to pay that Part B deductible, they won't go to the doctor so much and they'll save Medicare money. However, if they would have asked me, I would have said you have it exactly the wrong way. If people don't go to the doctor, they get sick. and they cost us more money, but nobody asked me, unfortunately. Okay, so for people born after January 1st of 1955, there is no access to the C or the F. The G is probably the best coverage. The only thing it doesn't pick up after Medicare pays is that Part B deductible. That's why I said, if you are risk averse, if you get original Medicare and buy a supplement like a Plan G, you pay $226 in medical bills, and then you have 100% medical coverage. My dad had an F and he's gone 12 years. Medicare paid, the F paid. I saw no medical bills. He probably used $3 to $4 million worth of healthcare his last 2 years of his life. But the issue again here is these go up as you age. And some people, if they're healthy, don't want to pay for that. They don't want to pay for the risk, right? They're comfortable with going, you know what? I know what the benefit is of that Medicare Advantage plan. I can manage that. I don't want to pay for my Part B premium plus the supplement premium plus the Part D premium. All right, where and how do you want to spend your money? Here in Illinois, we're lucky we have a birthday rule that if you're between 65 and 75, I know why they did the age, right? You have 45 days from your birthday, you can switch to a different supplement. It's equal or lesser existing Medigap plan from your same company. No medical questions asked. I wish they would have done this a little bit differently, but they didn't. So this is good though. It gives you a little bit of an option to change every year around your birthday. So Part D, I just like to tell you, this says this one is for a good night's sleep. And this one's for the headaches I get trying to understand the new Medicare drug plan. Well, I like to think as a ship counselor, I'm your Motrin, your Advil, or your Tylenol. Okay, so it's offered by private insurance companies. You have to have A and or B to get a Part D plan. It is through a standalone. So when we talk about the original Medicare side, you have to get your Part D through a standalone separate drug plan. Or if you want the Medicare Advantage plan, you get the drug coverage in that plan. So it's an MAPD, Medicare Advantage prescription drug plan, okay? You choose the plan to meet your needs. When I help people, what drugs do you take? What pharmacy do you want to go to? That is it. I will, again, I look at the star ratings. If a company has less than 3 stars, and some do, I will recommend that they don't choose that plan. If they want to, because the costs are better, try it for the year and see what happens. Okay, because you can switch every year. This year, the standalone premiums were $4.90 to $103.90. The $103.90 is for people that probably have very expensive drugs, and the $103 or $78 or $80, whatever the higher premium is, doesn't have a deductible and really keeps the cost of those expensive drugs low. So again, where are you spending that money for your drugs and how? And it's strictly, I go on the Medicare website, it's got a tool, it cooks it, it spits out to me the cheapest plan for that year, based on your drugs, what drugs you take, the dosage, and how often. You can be that specific. Way. Should you enroll in Part D? Well, if you're on an employer plan, I will be honest with you, employer insurance covers drugs better than Part D. So I've had people, they're turning 65 and they're deciding whether they want to keep their employer insurance, because you don't have to keep it. It's a life-changing event. You can still work, but you can go off and go to Medicare. But I will tell you that when I have people that continue to work and stay on the employer insurance, usually they don't want to go to Medicare. It's because of the drug coverage. Okay, because they have family, spouse with really terribly, I'm talking like $9,000 worth of drugs. The good thing is, and I'll tell you in a second, they are adding a maximum out of pocket to Part D, so that'll be good. So do you want to stay on your employer insurance? Will the drug coverage end? Are you retiring? What are the premium and the cost for Part D plans? Without whacking, without creditable coverage. So if you don't get drug coverage because you didn't need it and you didn't have an employer group health plan, you'll get a penalty when you do sign up. Okay, so be very mindful. When Part D first started, people were like, "Oh, I didn't get any drugs. I don't." I say, okay, at that time, the cheapest premium was $13. Now it's $4 for $4.90 a month. Just get it. It's your choice, but that's the only thing I tell people to do. That's the only thing. Just get it. So you got it if you need it. Okay, don't cut your nose off to spite your face. It's offered by Medicare approved insurance companies. Choose the plan to meet your needs. I'm going the wrong way, so sorry. They tier the drugs and that's how they set their pricing. Generic tier 1, preferred generic is tier 1, non-preferred generic tier 2, preferred brand tier 3, non-preferred brand tier 4, specialty drug tier 5. I've seen generics be tiered to tier 4. Don't ask me why. It's just, and it's usually some kind of dermatology cream. If you have a dermatologist, I do, I'm going to be in trouble when I go to Medicare. So that's how they, and then this is important this year because of the Inflation Reduction Act, the cost of a 1-month supply of insulin is now $35. Okay, this is huge, but it does not include the A1C drugs like Ozempic, okay, and those types of drugs. And Ozempic retail, $950 a month. All these people that are taking Ozempic for weight loss, they ain't gonna do it when they go to Medicare because it's way too expensive. So it boggles my mind. It's very expensive. Jardiance, all these drugs that are A1C, they're not considered insulin. Okay, so this only pertains to insulin. All right, Humalog, Novolog, Atlantis, that's insulin. These new ones, I think Trulicity might be considered. So some of them are. I think Trulicity might be under this. No, it's not.
I don't think so.
Okay, one of them is.
Trulicity is kind of the same as
Ozempic. There's one that is covered that I was,
Yeah.
okay, I apologize for that. So vaccines now are covered under Part D. There used to be a big copay. Now there's no cost sharing for like shingles, your shingles vaccine. Let me keep going. Let me keep going. So please, you can call us. You can call the ship counselors at tons of locations throughout Illinois. Okay, Advocate Good Shepherd. We have a couple in McHenry County, like the Arlington Heights Senior Center. I know a lot of senior organizations might have a volunteer ship counselor or like a township. I know out in Lake County, Ela Township has a ship counselor. So please get help if you need it. Part C, again, that's that right side. It's the other way to get your Medicare. Why is it different? Medicare plans are all in one. Medicare pays a fixed amount for your care to that insurance company, and they have to follow rules set by Medicare. Plans have different rules of how you receive your services. So technically, if I'm scrolling through 52 plans, what I'll do is I'll say to people, we put in your drug list, that'll show me lower drug costs for the plans. Do you want an HMO or a PPO? If you have a specific choice, we'll filter it only for PPOs or only for HMOs. And then we'll start looking at maximum out of pocket. What do you think you could afford if something terrible happened, okay, in a given year? Till you've reached 100% coverage. And then we would look at networks. I've had 3 or 4 plans for people, but only one, their doctors were covered. So it really does influence those issues. What's the best Medicare Advantage plan? You have to be enrolled in A and B to get a Medicare Advantage plan. And again, enrollment 2023, 50-50. 50% of the country is in the original Medicare with a supplement. 50% are in Medicare Advantage plans. It covers all the benefits, rights, and protections. It does cover the drug coverage. You get one with drug coverage. You know, you have to follow networks. And again, 62% don't have an extra premium, but there are plans with premiums. It varies on county, remember? Lake County 43, McHenry County 52, Cook and Kane 59. Depends on where you live. And then you present that Medicare Advantage card to all your providers in your pharmacy. That just like when you worked, that is your insurance. It's your Medicare contracted approved insurance. So basically, you may not pay a premium, but you'll pay as you go. With original Medicare, you pay that premium for that supplement for what if to not pay later. The supplement plan, those prices go up as you age. Okay, they know they can't drop you the supplements, but they know the older you get, the more you might cost. Okay, unfortunately. And then the Medicare Advantage plans do have extra benefits that original Medicare doesn't have. It does have, and I'm going to say this, a little bit of dental, a little bit of hearing, a little bit of vision. Be very careful. It does have a fitness benefit. I have people who's like, I want my lifetime free. So they go to Medicare Advantage so that their membership is free. And I don't know what'll happen when they actually use it outside of the fitness benefit, but we do our best, okay? So there is extra benefits that original Medicare doesn't use. Oh, sorry, I'm going the wrong way. They do have maximum out of pockets. Look at the star ratings. I would never put anyone in a plan that had less than 3 or 3.5. Those premiums do not, if there isn't, increase by age, and there's no medical questions asked. You can whenever you apply. Prescription drug costs are not included in the maximum out of pocket, but one of the other big things about the Medicare the Inflation Reduction Act is in 2024, there will not be a catastrophic period. So you'll go from a deductible for the Part D for the drug coverage to initial coverage to what's called the coverage gap or donut hole. And then catastrophic will be gone. It is 5% right now, but I'm assuming at that point it becomes 0. In 2025, there will be a maximum out of pocket for all drug coverage, and it'll be $2,000, which is huge. Okay, huge. These are the extra benefits. Again, a little bit, and you know, even if they say, "Oh, we have $5,000 worth of dental coverage," you got to use their providers. And then you got to find providers. We've had some issues with plans. They give you names. And then the dentists go, we're not in network. So that is the one thing you have to manage, just like you do now. If you're working and you're on an employer group health plan, you got to go to where that insurance is covered, right? So the comparison with original and Medicare Advantage. You have to pay the Part B premium for both. For original Medicare, Medicare covers Part A and B benefits. You choose and pay a premium for a separate standalone Part D plan. The federal government actually provides you with your A and B coverage, so they bill Medicare. That claim goes to Medicare. You have a choice of any doctor or hospital that participates in the Medicare program. There are no networks. They just have to accept Medicare. And then if you have a Medigap plan, it will pick up those out of pockets. If you don't, you'll be responsible for them. With Medicare Advantage, there can be an additional Part C premium, but again, 62% do not have a premium. The plan is what covers your A and B benefits, and it can include those additional benefits and the drug coverage. Plans are offered by private insurance companies, but they're approved by Medicare. And most plans, you need to use networks of participating doctors. And you will pay as you go. If you know, the commercials are lying. It is not free. Yes, there may not be a premium, but if you use healthcare, you will have to pay co-pays and co-insurance. So, you know, whatever actor they're using that tells you how wonderful this is, you know, it's not, nothing's free. And that's how they get people, is because they think it's completely free, and it's not. Okay, you're gonna owe some money somewhere. You just have to decide where that is. The enrollment process, this is pretty big. If you're turning 65 and you're gonna retire, sign up for A and B. If you're turning 65 and you're working and you're on an employer group health plan with more than 20 employees, and you want to stay on that employer plan, just sign up for Medicare Part A only. It's free if you worked your 10 years. And it makes it easier when you do go to retire because you get a Medicare card and a Medicare number. You're in the system. So when you do go to retire, you've already got your number, you just sign up for Part B, and it's easier to get these additional benefits because you have a number. When people don't sign up for A, if you're on an HSA, you may not be able to sign up for A if you want to keep contributing to that HSA. That's a tax issue. But if you're not, sign up for A. It will make it easier. Okay. And if you're already on Social Security, you will be automatically enrolled when you turn 65. If you're not on Social Security, you have to enroll. It's through the Social Security website, ssa.gov. You set up a My Social Security account, you have to, and you enroll in Medicare through your account. It's a way for them to know you really are who you are and that you're not committing some kind of fraud, okay? You do not have to be retired to get Medicare. I have people that where I work that they're constantly debating. Do I stay on the employer insurance? Do I go to Medicare? Do I wait until I retire? And that's a decision you can make at 65. But once you're 65, if you don't have B, you're in a life-changing event form all year round. So you can go get B and transition to Medicare. Okay, I gotta go. But I want you guys to know we are at our table in the room. If you have questions, I'll stay here for a couple minutes to break down. When you turn 65, 3 months before your birthday, month of your birthday, and 3 months after is your initial enrollment. And then you get special enrollment periods and you fill out these forms when you are working beyond 65. You are protected as long as your employer fills out this request for employment information and it goes with your Part B application. Okay, I'm sorry, guys, this is just a really lot. And in conclusion, we are at our table. My coworker Sheila and I are both shift counselors to answer any specific questions. You can reach us anytime. Thank you. It's a lot of information. I apologize.